Hello, wonderful folks. I'm Dr. Rose Khavari, a urologist and professor specializing in functional urology and men's health right here, from the Department of Medicine at the University of Texas at Galveston, Texas. I've had the privilege of spending over 15 years working with so many amazing men and women just like you, understanding the unique health journeys we embark on as we gracefully age. You know, in my practice, I often hear very private yet incredibly common sentiments. For example, a patient over 70 once hesitantly shared with me, "Dr. Khavari, my spouse and I still love each other very much, but lately I just feel a lack of confidence in our intimate life. I thought it was just a part of getting older, but I really want to regain my spark." Or perhaps another gentleman will confide, "I don't feel as sharp as I used to be, so I'm hesitant to be intimate with my wife. I just thought this was a normal part of getting older and there was nothing I could do." Or perhaps a lady will say, "I no longer feel as interested or comfortable as before when we're intimate. Is there any way to improve this, doctor?" If any of this resonates with you, if you've ever felt a bit hesitant, embarrassed, or unsure about maintaining intimacy and joy in your intimate life at age 70 or beyond, then today's video is exactly for you. Today we're going to talk about a topic that many people often shy away from, yet it's incredibly important for our quality of life and happiness. Why blood flow is the secret to a healthy sex life at 70 plus. I know it might feel uncomfortable, but I promise you we're going to break down those barriers together so you can feel more confident and proactive in taking care of your complete health. Because getting older doesn't mean giving up intimacy or joy in life. In fact, there are so many gentle and effective ways to improve things, and often the key lies right in how our bodies circulate blood everywhere. Why blood flow is the crucial secret to a healthy sex life at 70 plus. Folks, when we talk about health at age 70 and beyond, we often immediately think about heart health, blood pressure, diabetes, or joint issues. And of course, those are incredibly important. But a healthy and fulfilling sexual life, or more broadly, the ability to enjoy intimate closeness, is also an indispensable part of a full and happy life at any age, including your 70s and beyond. Here's why this topic is so important, especially at age 70 plus. The foundation of sexual function. Whether you are a man or a woman, to achieve arousal, lubrication, erection, or orgasm, all require one fundamental factor: good blood flow. Blood carries oxygen and nutrients to the genital tissues and organs, helping them respond properly. When blood flow is compromised, the body's ability to respond will be affected, leading to difficulties and reduced confidence. A sign of overall health. Vascular health is a crucial indicator of your overall well-being. Problems with blood flow to the genital organs are often early warning signs of more serious underlying conditions, such as cardiovascular disease, atherosclerosis, diabetes, or high blood pressure. Focusing on improving blood flow not only helps your intimate life, but also protects your overall health. Improved mood and quality of life. A healthy sexual life can improve mood, reduce stress, enhance self-esteem, and bring a deep sense of connection. When you feel more confident in your body's function, that confidence will spread to other aspects of your life, helping you feel more content and happy. Maintaining connection. For couples, physical intimacy is a vital pillar of the relationship. Maintaining good blood flow helps you continue to enjoy this connection, strengthening love and mutual understanding. Even for those without a partner, understanding and supporting your body's function is a part of self-care and maintaining autonomy. Breaking down stereotypes. In society, there are still many misconceptions that older adults are no longer interested in or capable of having a sexual life. This is simply not true. By talking openly about the importance of blood flow and how to improve it, we are helping to break down these barriers, making more people feel comfortable seeking help and enjoying life fully. So focusing on blood flow isn't just about a private aspect. It's a comprehensive strategy to enhance cardiovascular health, improve intimate function, and boost your overall quality of life at age 70 plus and beyond. How our body and mind change. The impact of blood flow on intimate life. As we age, our bodies and minds go through several natural changes. It's important to understand these changes, especially how they affect blood flow so we can better care for ourselves and maintain a healthy, intimate life. Let's look in detail at how blood flow impacts intimate function in both men and women. 1. Blood flow and male sexual function. Erectile dysfunction, ED. This is a very common issue for men as they age, and the leading cause is poor blood flow to the penis. To achieve and maintain an erection, the blood vessels in the penis need to dilate and fill with blood. When arteries harden, atherosclerosis or narrow blood cannot flow sufficiently, leading to difficulties with erections. Link to cardiovascular health. Erectile dysfunction is often considered an early warning bell for cardiovascular disease. If the small blood vessels to the penis are compromised, it's very likely that the larger blood vessels to the heart and brain are also being affected. 2. Blood flow and female sexual function. Reduced lubrication and sensitivity. In women, especially after menopause, poor blood flow to the clitoris and vaginal tissues can lead to reduced natural lubrication and decreased sensitivity. This can make sexual activity uncomfortable or painful. Difficulty achieving orgasm. When blood flow to the genital area is restricted, achieving full arousal and orgasm can become more challenging. 3. Common factors affecting blood flow in both genders. Atherosclerosis. The buildup of plaque in the arteries causes them to stiffen and narrow, impeding blood flow. This process can be accelerated by poor diet, lack of exercise, smoking, and other risk factors. High blood pressure. High blood pressure puts strain on blood vessel walls, leading to damage and reduced elasticity of the vessels. Diabetes. Persistently high blood sugar levels can damage small blood vessels and nerves throughout the body, including those in the genital areas. Chronic inflammation. Prolonged inflammation in the body can damage blood vessels and affect the body's ability to produce vasodilating chemicals like nitric oxide. Medication side effects. Some common medications taken by older adults, e.g., blood pressure medications, antidepressants, can affect blood flow or nerve function, thereby impacting sexual function. Reduced nitric oxide production. Nitric oxide NO is a crucial molecule that helps relax blood vessels. As we age, the body's natural ability to produce NO can decline. Impact on psychological and emotional well-being. Issues with blood flow and intimate function are not just physical, they also have a profound psychological impact. Reduced confidence and performance anxiety. Difficulty achieving or maintaining function can lead to self-doubt, anxiety, and even avoidance of intimacy. Relationship strain. If not openly communicated, these issues can cause tension and misunderstandings between partners. Impact on overall mood. Feelings of frustration or embarrassment can lead to a general decrease in libido or even depression. The important thing to remember is that all these changes are common and manageable. They are not a death sentence for your intimate life. By understanding the central role of blood flow and adopting healthy lifestyle habits, you can find appropriate solutions and adjustments to continue enjoying intimacy and closeness in your golden years. Understanding right versus wrong. Debunking common misconceptions about blood flow and sex life at 70 plus. When we talk about blood flow and sex life at age 70 and beyond, there are many common misunderstandings and societal stereotypes that can make you hesitant to learn about or seek help. Let me help clarify a few things for you. Misconception number C1. Sexual function issues at 70 plus are entirely due to old age, and nothing can be done. The truth. While age can bring natural changes, many sexual function issues are directly caused by poor blood flow, which is often due to lifestyle factors and medical conditions that can be treated or improved. Blaming everything on old age might cause you to miss effective solutions or signs of a more serious underlying health issue that needs attention. Misconception number 2. Only men need to worry about blood flow for sexual function. The truth. Absolutely not. Good blood flow is equally important for women to achieve sensitivity, natural lubrication, and orgasm. Circulatory problems can affect both genders, leading to difficulties with arousal and physiological response. Misconception number 3. Just taking erectile dysfunction pills is enough to solve blood flow problems and improve your sex life. The truth medications like Viagra or Cialis can help increase blood flow to certain areas, and they are a valid option under a doctor's guidance. However, they do not address the root cause of poor blood flow like blood vessel damage from high sugar or inflammation, and often don't work well if overall blood flow is severely compromised. Focusing on lifestyle and nutrition to improve overall blood flow is the most sustainable approach. Misconception. Before. A sex life is no longer necessary or appropriate at 70 plus. You should just accept it. The truth. The ability to enjoy intimacy and sexuality is a vital part of overall health and happiness at any age. Pleasure and intimacy contribute significantly to quality of life, stress reduction, and enhanced connection. Accepting it without exploring solutions might lead to unnecessary frustration and a reduced quality of life. By debunking these misunderstandings, we can gain a clearer understanding of the importance of blood flow and effective ways to improve your intimate life at 70 plus and beyond. Simple habits to improve. Now we understand why blood flow is the secret, and we've debunked some misconceptions. So what can you do right now to improve it? Today I want to focus on simple habits you can adopt to enhance blood flow and consequently improve your intimate life. 1. The power of nitric oxide. Know from food. Nitric oxide is a natural molecule in the body that helps dilate blood vessels and improve blood flow. Natural nitrate-rich foods. Dark leafy greens, spinach, kale, bok, choy beets. These are nitrate superheroes. How to eat them. Aim for at least 1 to 2 cups of dark leafy greens daily. Add spinach to omelets, morning smoothies, or use beets boiled, roasted, or juiced to boost No. Citrulline and arginine-rich foods. Watermelon, citrulline, pomegranates, nitrates and antioxidants. Turkey, lean beef, peanuts, arginine. These amino acids are converted into No in the body. How to eat them. Enjoy fresh watermelon pomegranate juice, or incorporate arginine-rich protein sources. 2. Limit foods that damage blood vessels. For good blood flow, we need to avoid blood vessel enemies. Refined sugars and processed foods cause inflammation, damage blood vessel lining, and reduce No production. How to limit. Read food labels. Carefully reduce sugary drinks, sweets, and packaged foods. Trans fats and excessive saturated fats can promote atherosclerosis. How to limit. Avoid fried foods, packaged snacks with partially hydrogenated oils. Limit red meat and full-fat dairy. 3. Boost healthy fats and antioxidants. These nutrients protect blood vessels and support function. Omega-3 fatty acids. Fatty fish, salmon, mackerel, sardines, herring. Reduce inflammation, improve blood vessel elasticity. How to eat them. Aim for 2 to 3 servings of fatty fish per week. Avocados and extra virgin olive oil. Monounsaturated fats are heart healthy. How to eat them. Add avocado slices to salads, use olive oil for dressings or moderate heat cooking. Colorful fruits and vegetables, rich in antioxidants that protect cells from damage. How to eat them. Eat a rainbow of foods daily. 4. Regular exercise. Movement is the best medicine for blood flow. Cardiovascular aerobic exercises, brisk walking, swimming, cycling, dancing. Why it helps. Boosts heart health, helping pump blood more efficiently. How to exercise. Aim for at least 150 minutes of moderate intensity activity per week. Kegel exercises, pelvic floor. Why it helps. Strengthens pelvic floor muscles, which improves local blood flow to the genital area and enhances sensation orgasm ability and bladder control in both men and women. How to exercise. Perform 3-4 times daily, 10 to 15 contractions and relaxations each time. Consult a pelvic floor physical therapist for proper technique. 5. Manage risk factors. Work with your doctor to manage conditions that can affect blood flow. Control blood pressure and blood sugar. Adhere to treatment and lifestyle changes. Quit smoking. Smoking causes severe damage to blood vessels. These changes are simple to start and can gradually make an incredible impact on your blood flow and the quality of your intimate life. Sharing a real story. I want to tell you the story of a wonderful couple, George 74 and Martha 72. They had been married for over 50 years and still loved each other very much. When they came to see me, George looked a bit down. He said, "Dr. Khavari, I'm very frustrated about our intimate life. I'm having difficulty with erections and it's affecting my confidence. I worry that everything is over." Martha also nodded. "I feel like things aren't as sensitive as before, and I worry about George too." Upon examination, I noted George had a history of high blood pressure, and both admitted they didn't prioritize dark leafy greens or fatty fish in their diet. I explained to them that blood flow was the core issue, and we could improve it. I suggested some simple but powerful changes. Increase dark leafy greens in every meal, e.g. large spinach and kale salads or adding beets to soups. Regularly eat fatty fish like salmon for omega-3s. Drastically reduce sugar and processed foods. George started brisk walking for 30 minutes daily, and both practiced gentle Kegel exercises. Initially, it was a bit challenging due to old habits, but they persevered because they wanted to maintain their closeness. After about 4 months, George and Martha returned to my office, both beaming. George excitedly said, "Dr. Khavari, I can't believe the difference. I can say that things in the bedroom have significantly improved. I feel so much more confident, and the great thing is my blood pressure is also more stable." Martha chimed in, "That's right, doctor. I feel more sensitive and comfortable. Most importantly, we feel closer and happier than ever. All from focusing on blood flow." The story of George and Martha is a powerful testament that focusing on improving blood flow through nutrition and healthy lifestyle can bring about profound impacts on your intimate life and overall happiness at age 70 plus and beyond. It's not a complex magic trick, it's simple bodily science effectively at work. So to recap our meaningful conversation today, here are the key points I want you to always remember. Blood flow is the crucial secret to a healthy sex life at 70 plus, impacting arousal function and orgasm in both men and women. Blood flow issues are common but manageable and often signs of overall health. Improve blood flow by increasing nitrate-rich foods, dark leafy greens, beets, citrulline watermelon, and arginine turkey peanuts. Limiting refined sugars, processed foods, trans fats, and excessive saturated fats. Boosting healthy fats, omega-3s, avocados, olive oil, and antioxidants, fruits, vegetables. Exercising regularly, cardio, and Kegels. Managing risk factors like high blood pressure, diabetes, and smoking. Remember, small, consistent changes in your diet and lifestyle will lead to big improvements over time. This is about smartly nourishing your body, not a restrictive diet or harsh exercise regimen. You can start today by adding a serving of dark leafy greens to your meal or a brisk 20-minute walk. Dear friends, your health journey after 70 is a unique and precious one. It's a time for wisdom, for enjoying the fruits of your labor, and for savoring every moment. And proactively caring for your blood flow is one of the kindest, most empowering things you can do for yourself and for your intimate relationships. You have the power to influence how you feel, how much energy you have, and how vibrantly you experience life. Start today, one healthy step at a time. Listen to your body, allow yourself to seek natural solutions, and watch how your life becomes richer. You deserve to feel your absolute best every single day. If you found this conversation helpful, please consider subscribing to my channel. I'm here to support you on your journey to a healthier, happier life after 70, with more practical tips and insights on health and positive living. Wishing you all abundant health, boundless energy, and joyful days ahead. Until next time, take good care of yourselves. 9 to 38 a.m. 8/8/2025.